What is up, PT on Ice Daily Show? Happy Monday. My name is Dr. Shae Sharbutt, and I am with the Pelvic Division here at ICE. Today is Martin Luther King Jr. Day, and so some of y'all might have off of work. Some of you guys might have kids at home today, home from school. So I wanted to make today a little bit more specific, something to honor MLK, and we'll dive right in. So today, I want to talk about racial disparities, more specifically in the African American women population, and even more specifically during the pregnancy and postpartum period. This is super prevalent. So, you are going to see these patients in your clinic, and you are going to have these patients who, whether they talk about it or not, have experienced the racial disparities in healthcare. So, what do we do about it? We want to make sure we empower them with education. We want to make sure we're a referral source and we have resources for them to hand out. And we want to make sure we're encouraging healthy lifestyle factors as well as educating them on the more severe symptoms of things that might need more attention or maybe a trip to the hospital. So we'll dive right in. First of all, I want to announce that racial disparities don't pop up just when some prejudice is going on. It can be something like getting different care than their white counterparts. It could be getting different resources, getting different bits of education than their white counterparts. It doesn't have to be outright stereotyping or prejudice that seems obvious. So these women are experiencing these things. We know that Black women in America are way more likely to have preeclampsia, gestational diabetes, way higher likelihood of mortality and adverse birth events. So, again, this is super important, and we want to make sure that we're protecting our patients the best we can and providing them with resources best we can. So, to start off, what types of education do we need to provide for them? Tell them severe signs and symptoms to look out for. Take their blood pressure. For some of these people, they might have a baseline of high blood glucose levels. Their doctor should be checking for that. Their OB should be checking for liver function, renal function, fasting blood glucose levels, right? That's not in our scope. But what is in our scope is, hey, if you experience some severe right upper quadrant pain, show them where the right upper quadrant is. If somebody doesn't have a background in medical education, they might not know. So explain to them, if you have that, that's a severe sign. We need to be able to educate them, like, go to the hospital. Don't just ignore that. It might not just be indigestion if it's severe pain. Also explain to them that severe headaches that aren't being taken away with Tylenol, that's another severe symptom that they need to watch out for, as well as visual disturbances. These can all be signs of preeclampsia. On top of that, pulmonary edema, another severe sign that something more is going on. Don't just say pulmonary edema and brush it off. We want to make sure that they understand that that's shortness of breath, trouble breathing lying down. Educating these patients and empowering them for what to look for can be extremely helpful. And it could save their lives or their babies' lives. So we want to make sure we're educating them in the things to look out for, and we might be the only provider doing that. Okay, number two, we want to make sure that we're just educating them and empowering them to exercise and do healthy lifestyle things. We want to make sure we tell them everything they can do during pregnancy. It's anything they want, really. So we want to make sure that they're exercising during pregnancy, that they're hitting physical activity guidelines, that they know what that means, as long as they don't have a high risk pregnancy, right? We want to make sure that they know and feel comfortable being in the gym. We can be a resource for that. We want to make sure they understand sleep hygiene, so they're getting high quality sleep. We want to educate them on getting enough fuel and high quality foods, and what types of foods can help them feel better throughout their pregnancy and postpartum period. So all of these things are well within our scope as PTs, and we want to make sure we're building a really nice foundation for them. So first, we want to educate them on severe signs and symptoms, give them the empowerment to know when something's wrong, something more wrong is going on in their body, so they can take care of it. Two, help them build a healthy foundation. You might be the only provider encouraging them these healthy lifestyle changes that they can make that mitigate the risk of things like gestational diabetes. right? We want to make sure that we're covering all of our bases. Lastly, we want to know that we have a good referral source, a list of providers that we trust. Not every OB out there is going to be a provider that aligns with your values and your patient's values. You want to have a list of providers that you can refer to that will treat your patients with respect, respect their wishes, both during delivery and the postpartum period, and as well as provide resources for other providers that are good advocates, like a doula. Doula and midwives can be awesome parts of the care team, and having some to refer to and give your patients their contact information can be awesome. So, on top of all of that, we're educating. Again, education, education, education. We're educating the patients on severe signs and symptoms to look out for. We are empowering them with education of physical activity and lifestyle changes. We're making sure that we're helping mitigate the risks of these conditions. And we want to make sure that we always have resources to hand out to them as we would any other patient. We want to make sure that they have a whole arsenal of a care team to take care of them, right? So we want all three of these things. It can also be extremely helpful for these patients to have their support person with them. They have enough going on in their lives right now. They're about to have a baby. They're pregnant, especially that first pregnancy of their lifetime. They might be super nervous. They have all these things they have to think of. They have the wish list they have to create. They don't know what kind of crib or what kind of stroller they want. We want to make sure that a support person's with them so that they don't have to remember all the things, that they can have somebody to rely on, whether that be a spouse or a partner or a parent or a friend, just a good support person with them to get this education and just have somebody else on their side. So, to wrap things up, racial disparities exist. If we pretend that they don't exist and we ignore them, they're never going to change and it's never going to get better. And that's a disservice to your patients. We want to empower them with education of severe signs and symptoms, but also lifestyle factors to mitigate those risks. And then we want to make sure we have a good list of team members for them that they can rely on, that you trust to be better than what they've probably received in the past with healthcare teams. Okay. So if you want to learn more about treating this population, the pelvic space, our level 1 is sold out, which is super exciting. Level 1 sells out so easy. So get on that March cohort. The next opportunity for you to do a level 1 is in March. Get on it. It will sell out. Level 2, midnight tonight, the link closes. You can't get in after midnight tonight, and there's only a couple spots left. Level 2's also been selling out a lot, and you won't have until the next few months to get into a level 2. So if you've taken level 1 and you're ready for level 2, jump on it because it closes at midnight tonight. And then lastly, we cannot truly, truly treat this population without coming to our live course. Our live course is so good. And you want to come, you want to learn the internal exam, you want to learn how to help these patients breathe and brace and train their hips and load the core and do all the gymnastics things. We want to make sure that you're getting into our live course so you can fully treat these patients. The next live course is mid-March, March 15th weekend, and that's in Colorado. After that, it's the end of March in New Jersey. If something's close to you, check out the map on the website, the ICE Physio website. And if it's not close to you, buy a plane ticket. You're going to want to join us. So y'all have a great rest of your Monday. Thanks for chiming in. And if you have a day off, have a great rest of your weekend.